Okay, I'm going to go straight through a head to toe assessment. I am going to use medical terminology. It is your responsibility to make sure you understand what each of these words mean. So if you need to look them up or research them, please do that. It is your responsibility to know why we are assessing each body part or whatever it is that we're assessing. So as I'm going through this, if you're unsure where we're assessing the hair, where we're assessing the ear or the mouth or the lungs, please make sure you look that up. Okay, so we knock on the door. I'm sorry, and when I say to know why, I mean from beginning. Why do we knock on the door? Why do we introduce ourselves? Why do we wash our hands? Why do we provide privacy? Why do we get two verifiers? Why do we assess the LOC, which is A&O? Things like that, okay? Okay, so we're going to knock on the door. We're going to introduce ourselves. I'm going to knock. Hi, my name is Ashley. I'm going to be the student nurse today. How are you feeling today? Can you verify your name and date of birth for me? I'm going to go ahead and wash my hands. I'm going to provide privacy, and I'm going to don my gloves. I'm going to educate the patient on the head to toe. I'm going to go ahead and perform a head to toe assessment. This is just so we have a baseline, and so that we don't miss anything else that may be relevant to why you're here today. Now, remember, you are asking for permission, but kind of not asking for permission, but you are. Because we still need to get this head to toe assessment down. Okay. Another thing when it comes to the A&O, alert and orientation, there's a lot of people saying the patient is alert and oriented ×3. I'm gonna be honest, I'm not sure if that's in your book. I thought I remember reading A&O ×4, but I could be wrong. I need to double check that. But it is alert and oriented ×4. If you say alert and oriented ×3, that means they're disoriented to ×1 to something, and you need to document on that. So please, when you verify name and date of birth, you are verifying the person already. So when you go into your questions, you're only asking 3 more questions, but you've already asked their name. So they are A&O ×4 if they are A&O ×4. Okay, so we've educated the patient. We're going to go ahead. We've asked them their name and date of birth. We are going to ask them when is the next major holiday. Make sure you just get some sort of time. Where are you? Do you know where you are at this moment? And why are you here? So that gives us the person, place, purpose, and time. So patient is alert and oriented ×4. I'm going to go ahead and when I walked in, I assessed the room, right? I assessed the hair. I assessed the patient's face, whether they were smiling, whether they were crying, whether they appeared to be anxious. Now, remember, we're not going to write up here in our nursing notes, but majority of the time when you document the psychosocial is going to have cooperative, uncooperative, anxious, pleasant, just kind of your take on how they reacted to the situation where you were in there. But again, we need to assess their appearance, their hair. Is it dirty? Is it matted? Is it greasy? Is it wet? Is it dry? Is it neatly groomed? Are they neatly groomed? Okay, so we went ahead and we assessed the hair. Now we're going to assess the scalp. We're going to inspect it. We're going to split the hair into sections, small sections. We're inspecting the scalp for color, for dryness, for bald spots, which we know is alopecia, but we're not going to say alopecia. For lacerations, for scars, for drainage, for redness, anything that may seem out of the ordinary. Then we're going to go ahead and palpate the head, the scalp. We're feeling for lumps and bumps that may have been flesh colored that we missed when we were inspecting. We're feeling for any soft spots, any misformation or misshapen of the head, things like that. We're also assessing the patient's face for pain. We consistently assess the patient's face for pain every time we touch the patient. We also consistently assess the skin from head to toe. Okay, so I've palpated the head. Now I am going to go ahead and move down to the ears. I'm going to start from the outside in on one side of the ear. I'm going to look at the skin behind the ear, make sure there's no buildup, make sure I can actually assess the skin. I'm looking for redness, tears, lacerations, drainage, buildup, cleanliness of it, any bugs, anything like that. Again, that's out of the ordinary, nodules, bumps, tenderness, swelling. Also assess the outside of the ear. Do they have any piercings? Are the piercings intact? Is there any drainage? Is there any odors? Any signs, symptoms of infection? Go ahead and pull the ear up and back for ages 3 and older. And you're going to take your pen light and look inside. Let me know what you see. You should see cilia. You should see cerumen. You should not see blockage, drainage, redness. And again, ask the patient if they have any pain in their ears. Go ahead and walk around the bed to the other side and assess that ear as well. Do not have the student turn their, or I'm sorry, the patient turn their head. You cannot see down the canal. Walk around and assess the ear the same way you did the other ear. Go ahead and move to the front of the face. Even though we're not going to actually state that the forehead is okay, make sure you are assessing the forehead for any lacerations or drainage or anything, any swelling. Go ahead and move down to the eyebrows. Have them go ahead and raise their eyebrows, find their eyebrows. Go ahead and have them smile and frown and make sure the face is symmetrical. You're going to take your thumbs and feel the eyebrows for any lumps, nodules, bumps. You're also assessing the face for pain. You probably at this point maybe want to go ahead and feel around the eyebrows and around the eyes for orbital edema, for any swelling, any tenderness, and again assessing the patient's face for pain. Then we're going to go ahead and have them close their eyes, assess their lids. Their lids, eyelids, they are skin, so the skin should be intact with no redness, no drainage, no tears, no cuts. Go ahead and take your light and assess the eyelashes. There's no drainage. There's no drainage on the eyelashes, no mites, anything like that. Have them open their eyes. We're going to go ahead and assess the eyes from the outside in. Go ahead and take your thumbs and pull the lower eyelids down. We're assessing now. Remember, we have membranes. Membranes line your body. The inside of our body that lines us. It's different names, but it is one sheet of lining. In our eyes, the lining in our eyes is actually the conjunctiva. So take your thumbs, pull them down, make sure the conjunctiva is pink, moist, and intact. Make sure there's no drainage, no leakage, no discoloration. Then assess the sclera, which is the white part of the eyes. So the sclera bilaterally is white, no discoloration noted. Go ahead and turn off the light. Take your pen. We're going to assess for perla. Take your pen light, put it on the side of the ear. Tell the patient, go ahead and stare straight. You're going to point the light in their eye. Please try not to blink. It'll only take a couple of seconds. Take your pen light, turn it on. Shine the light into their eye, at which point the pupil should constrict. Make sure you take note to add to what point, what number it constricts to. Go ahead and turn the light off. Go to the other side of the head with your pen light. Assess the other pupil as well. Go ahead and turn your light on. Take your pen light. Tell the patient to go ahead and follow the pen light with their eyes only. Do not move their head. You're going 10 points. You're going to move the pen up, back to the middle, down, middle, left, middle, right, middle. And then do your star. So you'll go like upper left and then lower right, upper right, lower left, and then come all the way into the nose and pull all the way out. We want to see their eyes follow that pen. So at which point you can say bilateral perla noted. Pupils are equal. They are round. They react to light and they accommodate. At this point, you can take your thumbs and you can feel down the bridge of the nose. The septum, it should be midline. It should not be deviated to the side or moved to the side. Go ahead and assess for patency. Make sure when you come in with, I'm sorry, interruption real quick. Come in with your stethoscope, your pen light, grab a napkin and grab a tongue depressor. Okay, so go ahead and assess for patency. Have them shut one nostrils and breathe in and out. Shut the other nostril and breathe in and out. At this point, you're using your auscultation to make sure that it is both nostrils are patent and they are taking the same about even amount of air in and out through their nostrils. Oh yeah. Go ahead and take your pen light and assess inside the nostrils. You should see cilia. It should be pink and intact. You should see no drainage, no redness, no blockage. Go ahead and let me make sure I'm done with the nose. We have at the nose. We assess the inside. We assess for orbital edema. We check patency. I feel like I'm missing something. Okay, so we're going to go ahead and go down to the mouth. We assess the lips. We already assessed the smile. Well, we already assessed symmetry. So we're going to assess the lips. Just make sure that the skin is intact, that they're not chapped. There's no cracks. Go ahead and have them open their mouth and say ah, at which point when they say ah, we want to see the uvula in the back react. It should kind of shake or pull up towards the back a little bit. You're assessing the back of the throat. You're assessing the buccal or buccal area. You're assessing the hard palate, the soft palate, the gums, making sure everything is pink, moist, and intact. You're assessing the teeth. Are there any missing teeth, broken teeth, loose teeth? And are they their teeth? Let me make sure I got all inside the mouth, the uvula, the buccal, the hard palate, soft palate, the gums, the teeth. I think I got everything there, y'all. Okay, at which point we're moving down. I apologize. I forgot about the temporal pulses. Make sure you assess the temporal pulses. Those you can feel, you can palpate at the same time. The temporal pulses are not on the sides of the forehead. They are in front of your ears, right in front of your ears, the tragus part. You can look that up in your A&P book. So please make sure you look that up if you're unsure where that temporal pulse is. You need to be able to assess that properly. You need to be able to have your fingers in the right place. Make sure the temporal pulses bilaterally are present and palpable. Go ahead and move down to the neck. You're going to palpate for the carotid arteries, for the carotid pulse, one at a time. Make sure it is palpable and present and they are equal in strength and force. Go ahead and have them look to the left and the right. You're looking for JVD. Go ahead and slide a finger down the side of each neck when they turn to make sure that you don't feel any swelling or distension of that jugular vein. At which point we're going to massage the soft tissues from the jaw down to the neck, inside the clavicles, out towards the shoulders a little bit. We're feeling for any swollen nodules, lumps, bumps, and again, assessing the patient's face for pain. You're going to go ahead and move down. You're going to assess the chest for rise and fall. Make sure it's even and not uneven. Make sure it's symmetrical. Assess the force. What is the word I'm looking for? Oh, what is the word I'm looking for? Assessing the oh y'all, the word is on the tip of my tongue. The effort of the patient to breathe for each breath. That was so hard. So we're assessing the effort. At which point we're going to go ahead and listen to lung sounds. Now remember, you're comparing. So you're going to listen anterior. When you listen to anterior, you're going to listen from left or right. But I'm going to start at the left. Above the clavicles, you're going to listen with the bell of the stethoscope. You're going to listen to, I'm going to say the left side. For breath, make sure you hear air coming in and out. Listen to the right. You're comparing those sides. Then you're going to come straight down. So that you can listen to the two upper lobes, right? So you'll listen, I went from the left to the right, down right, back to the left. So I'm comparing those two sides of the upper lobes. I'm going to go straight down, staying on that left side again, listening to, it's on the left side, so it's not the middle lobe. But once I go to the right, but I'm still listening to lung sounds, I'm going to go to the right side. At that point, I'm listening to the right middle lobe. I'm going to go ahead and go to my 7th space. If I need to, using the back of my hand to lift or having the patient lift so that I can listen to those lung sounds, the lower lobes. There are 8 places in the anteriorly you should be listening to, and then 10 spaces posteriorly you should be assessing. Ooh, yeah. If you don't hear any adventitious lung sounds, then the lung sounds are clear to auscultation. Now at this point, I'm going to listen to the heart sounds. That first heart sound is my aortic. It's going to be in my 2nd intercostal space to the right of my sternum. Then I'm going to listen to the pulmonic heart sound. That is to the left of my sternum in the 2nd intercostal space. Erb's point in my 3rd intercostal space, also on the left. Tricuspid between my 4th and 5th space, also on the left of the sternum. Then I'm going to listen to the mitral, which is also the apical pulse, which is mid-clavicular 5th intercostal space, at which point I'm going to listen for a full minute. Please listen for a full minute. Real quick, another thing I didn't add, make sure you have your secondhand watch. If you do not have your secondhand watch, you will not be able to complete your head to toe. Okay, so I've listened to all the heart sounds. I am now going to go down to the abdomen, at which point I'm going to inspect first. I'm looking for discoloration, scars, lacerations, tears, bleeding, discharge, anything like that, bloating. I want to take note of it. Is it bloated? Is it flat? Just does it look kind of out of the ordinary? Then I'm going to go ahead and auscultate, following by way of digestion. I'm going to start at the right lower quadrant, move it to the right upper quadrant, move to the left upper quadrant, move down to the left lower quadrant. I expect y'all to listen to each quadrant for 1 full minute. I expect you to know what the normal range of bowel sounds are, and what to do should you not hear any bowel sounds. Once you auscultate the bowel sounds, then you'll palpate the abdomen. Now remember, you're only auscultating on the large intestine, but you're palpating the whole abdomen. So palpate the whole abdomen. You're feeling for any nodules, any bumps, anything out of the ordinary. Also assessing the patient's face for pain. Go ahead and ask your assessment questions. When was their last bowel movement? If it's well, no, let's not do that. When was their last bowel movement? Can they describe it? So your color, your odor, your amount, your consistency. If they've had any nausea, any vomiting. And I think that's it. Okay, so then we move down to the urinary. Ask them those questions as well. Last time they urinated, coca, that stuff as well. And then, make sure you're asking about any itching, any urgency, any burning, so we can go ahead and exclude any signs and symptoms of a UTI. Then at which point we're going to go ahead and you will not be assessing for the femoral pulses or assessing the peri area, but you will go ahead and talk about it. At which point I'm going to go ahead and assess for the femoral pulses. They are palpable and present. Make sure you know where they are at least. So if I ask you to tell me where they are, you can. And then I'm going to assess the peri area because it is skin. I'm going to assess the skin for any tears, any lacerations, any discoloration. I'm going to go ahead and assess for any discharge, any odor, any discoloration of that discharge. And if there's anything like that, I can go ahead and ask my assessment questions as well. I'm going to go ahead and turn the patient over and spread the gluteus or the buttocks. And I'm going to assess for any hemorrhoids, any redness, any wounds, any lacerations, or any beginning of um, pressure, signs and symptoms of pressure sores. Okay, so I'm going to put the patient, I'm going to go ahead and assess the back since I have them turned over as well. I'm assessing the back as well, the skin, for any signs and symptoms of pressure sores, any redness, any dryness, any tears, any lacerations, any discharge, anything like that. I'm going to go ahead and lay the patient back on their back. Now you can go ahead and begin with your patient again. We're going to go ahead and assess the thighs. We're palpating, well, first we're assessing the skin throughout. Then we're going to palpate the thighs again for any, just anything that feels out of the ordinary, any bumps, lumps, nodules. Go ahead and assess the patient's face for pain. Go ahead and move down to the knees. Same thing. We're going to assess for the popliteal pulses. Both bilateral popliteal pulses are present and palpable. We're gonna go ahead and move down to the shins. I'm gonna assess the top of the the calves and the shins. I'm gonna go ahead and assess for any edema by pushing at three different spots of the shin and seeing if I see any pitting edema. I'm gonna go ahead and look at the back of the leg, at the calf, and see if I see any redness. If I see any redness, I'm gonna assess for any warmth. And ask the patient about any pain. And I'm going to go ahead at that point. I would stop and let the provider know. If there is no warmth and there is no redness, I'm going to continue with my assessment. I'm going to go ahead and move down and I'm going to assess for the tibialis, posterior tibialis pulses. Bilaterally are present and palpable. I'm going to assess for the dorsalis pedis pulses. Bilateral are palpable and present. I'm going to go ahead and let me think. So I did the calves, I did the shin for edema. I moved down, I felt the pulses. Okay, I'm going to go ahead and assess capillary refill on all toes. I'm going to assess the skin. I'm going to assess the heels. I'm going to assess in between the toes. I'm going to go ahead and have the patient push with their feet on my hands as though they're pushing the gas pedal or the brake. I'm going to go ahead and have them point their toes to their nose as well. We're assessing the range of motion of their ankles at this point and their toes. And for strength, for strength as well, which is neuro. Then we're going to put our arm up and we're going to have them lift their whole leg up to reach our hand, one leg at a time. That's assessing the range of motion of the hips. Capillary refill, I did strength, I did range of motion. Okay, I'm going to go ahead and move up, and I'm going to move up to the arms, at which point I'm going to do the same thing. I'm inspecting the skin on both arms. I'm going to palpate the upper arm and palpate the other upper arm. Again, for bumps, nodules, assessing the patient's face for pain. I'm going to go ahead and assess both brachial pulses, which are bilaterally present and palpable. I'm going to assess the radial pulses. Both are bilaterally present and palpable. I am going to assess for skin turgor on the back of the hand. No tension noted, or maybe tension will be noted. I'm going to assess the capillary refill of each finger. I'm going to have the patients squeeze my fingers so I can assess for strength. I'm going to have them push on my hands and pull on my hands. I'm going to have them lift their arms to assess for range of motion. Okay, so I've assessed the arms, the pulses. I did the temporal, carotid, apical, brachial, radial, femoral, popliteal, dorsalis, tibialis. I did strength. I did skin throughout. I did the back. I did the front. I did heart sounds and lung sounds. We did strength of the hands and the arms. I didn't forget. I did skin turgor. I did the eyes. Okay, I think that's it, y'all. Please remember that after your head to please take a pen and paper, because after your head to toe, you are expected to write a nurse's note. Remember that nurse's note about your head to toe. Just do your best. Remember to stay away from opinions. Opinions don't matter. Everything is facts. What did you see? What did you feel? What did you hear? What did you taste? What did you feel? All of that good stuff. We don't find our patients. They don't appear to be any kind of way. Always sign, always date, always time it, always one line for errors with initial, date, and maybe if you can fit the word error up there. Make sure it's legible. Use medical terminology. If you don't know it, look it up, research it. I hope you have 2 pictures of the list of words of what not to use. If you didn't, please reach out to other classmates to get that. Other than that, I will see y'all tomorrow.